welcome to the B Team Podcast. I am your host, Josh Safran, with my co-host,
Matt Mars,
and our permanent guest,
Rob Nelson.
We're here every week to talk to you about all things Bentonville, bourbon, and business. The B Team Podcast. Be here. Welcome to the B Team Podcast. I'm your host, Josh Safran, with my co-host,
Matt Mars.
You saw the look away there, right? I confused him.
You didn't confuse me.
No, I confused Matt. And my permanent guest?
A little pause there, Rob Nelson.
Well done.
Bobby,
welcome back.
Yes, thank you.
And we're here every Thursday for all things Bentonville, business, and bourbon. Before we get into the Ray Finkel shirt, because we do have to talk about that for a minute or two, because that's money.
It's a classic shirt.
Rob was responsible to bring in a bottle of bourbon today.
Mm-hmm.
And he claims he brought in a good bottle, and Matt, this is a good bottle.
Yeah, that's a good bottle.
But the problem is it's open, and I'm not really sure what's in here. And last time he brought in a bottle, it was that Infinity bottle, that crap. So I'm going to ask you to try this first, because...
Okay,
you feeling good?
Well, I'm feeling... I think I might have been over there when he opened it, so I think it's legit.
Yeah. Matt remembers that's probably where we left it off.
Yeah.
Do you want to try that first before we...
Yeah, I'm going to do a little taster.
Mm-hmm. Now, normally we all drink these together, Jordan. We're not really sure if Rob did something here to the bottle.
I'm concerned that that's your reputation. Yeah, Josh just likes drama.
The viewers, they get upset when he's not here?
It's because they love him.
Haley and your mom, they're big fans?
That's right. And my friend from Hawaii.
I forgot about him.
And that makes up 50% of the viewers. Don't forget the third one.
The guy from Hawaii.
Yeah.
All right, so let's try this.
Oh, thank you much.
All right, let's cheers it.
Cheers.
Yeah. Cheers.
This is one of my...
I've not had this
It's
before.
one of my favorites.
You turned me on to it.
It's good.
He's turned you on.
To it. I mean, Josh only hears what he wants to hear. Ooh, thank you. Yeah.
What's the proof on this, Matthew?
It's up there.
Yeah, it's got a lot of heat on the back end. It's got a lot of flavor, though.
Here it says, let me see it.
I got old eyes, I can't see.
Yeah.
It comes for all of us, man. Right when I hit 40, it was like my eyes just quit working.
I had the best vision ever, and now I can't see 2 feet in front of me.
Really? It's 108.
That's not fair.
No, it's not bad. That's good, though.
You need glasses?
Yeah, for reading. Like, if we were sitting in front of my computer, I'd have my glasses on now.
Okay.
Maybe you should start wearing them during the podcast.
Yeah.
Some of those, we could
I
get
don't
him
have to
some of
read
those
anything.
bottle caps. We could call them bottle caps. Mr. Magoo glasses.
Josh is too vain to put a pair of glasses on.
No. Actually, I forget them when we go out to restaurants, so Emily has to read the menu for me.
Yeah, it's pretty bad.
You're one of the guys with the flashlights and the...
Oh, yeah, I'm that guy. I used to make fun of that guy. Now I'm that guy.
It happens really
That
fast.
guy. What's this with the Ray Finkel shirt you've been holding out? That's a great shirt.
I just brought some of the good stuff today.
That's good. And the fact that Bobby didn't know who that was, concerned
Well,
me.
I'm not a big fan of that actor, but
You're not a movie fan?
not like movies.
What kind of movies?
Top Gun.
Are you like a rom-com kind of guy? My wife's telling me I have to be a rom-com. I go, what's the rom-com? Romantic comedy. Is that it? Who knew? I didn't know. She told me I have to be a rom-com guy. Is that you, Bobby?
Sure. I mean, I think he is when he needs to be.
I think Angie's probably the rom-com. Anyway, we're here on Thursdays for all things Bentonville, business, and bourbon, and Jordan's here, the man. Salt Health.
That's me.
It's like I didn't even know what this place was. I've driven past it because it's by the Gents place, and then Jordan's a member of the Gents place, and we did a member event there,
Which
and I
was
walked
amazing.
in.
Yeah.
And the feedback we still get to this day is it was one of the best member events we've ever done.
Yeah.
Let's do it again.
Yeah, we need to.
It's been a couple of years, right?
Yeah.
At least.
Yep.
Because everybody was blown away. So give us the background, like what is Salt Health?
Yeah. So amazing question. Salt Health was meant to be an innovative, disruptive solution to the traditional healthcare system. I've been working in healthcare for almost 20 years now, and we often refer to it as sick care instead of healthcare. And so for us, we wanted to create an environment that could actually partner with people to get healthy, and to do it in a way that would put as many resources as possible in one location and working together with one team. So we are medical, fitness, and spa all under one roof. We have a full primary care medical office that includes our amazing team, our chief medical officer, our partner. So my wife and I and Dr. Herbst are the co-founders of Salt Health and owners. And Dr. Herbst is amazing. She is our physician and chief medical officer. We have nurse practitioner, dietitian, health coach. Then we also have personal trainers. We have massage therapist, esthetician, just resources all in one location to help partner to you. And as we say, live life healthy.
So for those that aren't familiar or are typically going to a general practitioner, getting their flu shots, going in for their physicals, the whole 9 yards, following through with health insurance, like the difference between the two is what? I can do all those things with you?
Oh, well, so it's a great question. So we are what's called the direct primary care clinic. What that means is we work directly with the individuals and the consumers, so we don't go through insurance. And that includes government payers as well as, private insurers. So basically what you're paying for is the access and the expertise. So for a monthly fee, you can come and have your appointments with no copay, deductible, coinsurance, no office visit fee. You just have the opportunity to come in and have that primary care team help partner with you, take care of you. There's cash pricing available for labs or advanced testing, or we can actually send those to Quest, for instance, and you can run those through your insurance if you'd like. But the individual care, that partnership, and those appointments are what are included in that direct primary care arrangement. But we are a full-blown primary care office. That means handling the acute care needs, those urgent things that come up, whether you're just having, not feeling well for the day, first signs and symptoms of that, or whether it is, wellness, whether it is management of chronic disease, annual physicals, all that good stuff. Anything that you would go to your general practitioner, primary care, family medicine, there's lots of terms for it. We are that primary care setting.
So Bobby was sick for 10 days, never sick before, right? You were sick
Never
with the flu.
that sick.
So like he could have come to see you guys as part of this and
Absolutely.
diagnosed medicine, all that.
Yeah, he needed you guys.
You should have come on by.
Flu A, man, it was rough.
It smoked you.
Smoked me.
Yeah.
And usually I don't get sick. Yeah.
This was a tough season, I will say. I mean, the combination of illness from young to old was pretty severe.
Yeah.
So you were not alone. That doesn't make you feel any better.
Yeah.
But we have again a great team. But we even take it another level. We'll do IV nutrition.
Love me a good IV.
Yeah. So and we treat it a little more medical than a lot of places. We don't necessarily say come in and pick your own cocktail. We like to have your labs in place, know what supplements, what prescriptions, all those things. And then as we've established that care with you, it just gives us an opportunity to provide even a more personalized IV experience than those traditional settings.
Jordan, the folks in town that would work for a consumer products company or a Walmart or something that have like their core insurance covered by their company.
Yep.
They would have to pay above and beyond, right? Or can HSA cover what you guys do?
Yeah, good question. So there's funny rules with HSAs and direct primary care. The official response is that you need to verify with your individual HSA plans because there's so many different ones. So some HSAs will cover things like massage therapy, some will cover supplements, others are a little more strict. So you have to kind of be willing to do a little bit of research on your end with that HSA. But it is HSA, but it is above and beyond. That is true. And I will say the majority of our customers overwhelmingly have insurance. What they're looking for is better service and better value. And so for us, perfect example, Bob, you could have called the primary care doc and been sick, and they might have said, oh, you got your first next appointments available in 3 weeks.
Yep.
Well, I won't even be sick in 3 weeks.
Yeah, exactly.
And then again, you might not have seen that individual for 2 years. And so for us, it's about a continuity of care over a long period of time. And even if it's a telemedicine visit, which we do, and we have after hours portal for our members as well, you're going to get one of our providers. We're not farming out that telemedicine visit to some PA in Kentucky, which a lot of the large health systems and groups do.
So you would not recommend me with a company I pay half my benefits to not do like United Healthcare or Blue Cross Blue Shield. You would not recommend, hey, get rid of that and come see me. You would add this on as supplementary.
Yeah, so I would look at it. It depends on each individual. I actually had the conversation this morning with a friend of mine who was around my age, self-employed. And, everybody needs some form of insurance is what I would recommend kind of as a general statement. Catastrophic is a perfect example. If you're in pretty good health and, you haven't hit your deductible in the last 4 years, it's probably a pretty good sign that you may not need like the most aggressive insurance plan where you're paying these insane premiums and you're never even going to the doctor. Because that's actually the disincentive with the traditional system is every time you go, you pay and you've already paid the premiums. And so I love to give the example of like the difference between health insurance and auto insurance. So you pay your auto insurance, you're really only paying for that catastrophic. That's the only you need new tires, you need a new transmission.
You're paying it.
You're just paying it.
Yeah.
And so for us, all the cost that is associated with healthcare is skyrocketing and has been for the last 15, 20 years. And people are incredibly frustrated with it. There are ways to kind of hedge your bets to say, you know what, instead of just putting all my money into premiums, which I'm never going to use.
So just lower what you,
There's an option where you could say, well, I'll take a little bit higher deductible. And with that savings, I might apply that to a monthly membership at Salt Health. And then I might have something I'm actually going to use. Because not only do we have that amazing medical team, but as a member, you get access to our facility, which you guys saw is amazing. It's we really wanted it to be a place for community and a place for people to get well. And so we've got a full fitness center, fitness classroom. We got virtual on-demand classes as well as in person. And then our spa is pretty top notch. It's got infrared sauna and steam and our cold.
And that's all included.
It's all included with the membership. Yeah. So you can come every day, even if you don't have an appointment that month. You're still there and available. You need to, just maybe you don't want a full appointment, but you want to have, a 15-minute check-in, or you just want to send a portal message about, hey, I've been on this new supplement for X amount of time, or this new prescription for X amount of time, and, I'm having this impact. My appointment's not for 3 more weeks, but I kind of had a question. You just send that into the portal, our team will respond to you. If it needs to be seen more urgently, we'll work you in. If not, we'll keep your appointment, and then just come use the facility as much as you like.
So guys like yourselves that don't work for a big company, you guys work for yourself to some degree. This is something that would make more sense for you?
Yeah, I mean, Angie, she came to the members event a few years ago, and she's been talking about wanting to join for quite some time. And I think for a while we were even on the wait list.
Yes.
That's a good problem to have for you guys.
Yeah.
It's a good problem. I mean, we don't love that there's a wait list because, man, we want to help as many people as possible. The whole thing is if we throw in a whole bunch of people all at one time, we're going to fall right into that same trap that everybody else does, which is not having enough time to spend with our customers. And so we call our patients, we call them members because they are a member of the Salt Health community.
Love that.
But as we do that, the traditional primary care office, you're looking at a 6 to 7 minute appointment, like actually face to face with your physician or PA or nurse practitioner. And so for us, you can't get to like the root cause of what's actually going on, or to actually learn about what's going on in their life from a diet, lifestyle, sleep, all of those wonderful things in that short of a time. And so our appointments are much longer, which means that we have to limit that, what would be a traditional called a patient panel. And so for us, it's more about, that quality of time and that quality of interaction rather than the quantity of members. I would love to double my membership tomorrow as a businessman. There's no question about that. But I'm trying to balance with the team what works really well to ensure that we keep having that.
Is there still a wait list now?
There is a wait list now. We're actually recruiting another physician, which we're really excited about.
You're still on the wait list, huh?
I think
because Matt jumped past you and he's already in.
Yeah. I mean, that doesn't surprise me. I guess maybe I could jump in on the back.
Well, did Josh not tell you that, the host and co-host got on, but they didn't have room for the guest?
That's fine.
But he said he's hoping if they get this new guy hired, they can
bring me.
Matt and I've been going every day.
Spirit.
I'll put it to you this way: if Angie wants to be connected, I'll make sure that she gets priority.
I appreciate it. I appreciate it.
Yeah, because these guys are hating a little bit on you. You've got one person in your corner, man. All right, I got you.
No, but I will say, I went to the event, and I absolutely love I love everything about your guys's, I guess the program that you have, because to me it brings you back to when we were all kids and you could call your doctor and talk to him, and I don't know, I just think medicine in general has become, you're just like you said, you're a number and that's it. Whereas you don't have any personal connection, and they don't really have time to find out probably really what's wrong, and they just throw a prescription at you.
It's funny. Again, I worked in the traditional system for many years, so there's a lot of great work done there. So I'm always like not one to bash that.
Yeah.
With that said, there are so many things that are just set up against physicians and healthcare teams in the system. It's really the system and the structure that makes it difficult to succeed. And so one of the examples you just gave is so true. I mean, a lot of us grew up with, you had a family doctor. That family doctor took care of your parents, took care of you, maybe your grandparents, and they were in the community forever. They'd see you in the hospital. Maybe they even delivered babies for you, all those different things. Everything's become super subspecialized. So for most primary care, they're maybe only seeing outpatient, or they're only seeing inpatient now. They're no longer doing like scopes or delivering babies. There are a few still doing it out there, but it's super rare. So that environment of, oh, hey, my doc is going to see me in the clinic, and then if I get admitted to the hospital, they're going to come check on me, that it's gone.
Yeah.
They just don't do that
Which
anymore.
is huge.
And so that continuity of care and that communication, of course, they'll tell you, oh, we've got electronic medical records. Well, they don't talk. I'll just be honest and tell you, the hospital in Fayetteville and the hospital in Rogers, they're not communicating with the systems like you would think.
Sure.
And so it just creates barriers for communication, workflow, and that continuity of care. And so it's kind of like the old school.
Yeah.
The method is I love to give the example of our dietitian. So we hired a dietitian day one. So we opened in a temporary clinic in September of 19. Before we saw our very first member, we had a dietitian on the team. We were very much committed to that diet, lifestyle, nutrition being a part of what we do. But most docs would say, oh yeah, have you ever, if they even ask this, have you ever met with a dietitian? Well, the conversation stops there because they don't know a dietitian and they don't know who to send you to. Yeah. And so our model and concept was, Matt, we're going to take you down the hall and you're going to meet the dietitian, and he's going to...
I like how he called you out, Matt, instead of the rest of us.
He's right here. I could reach
him. And that's he knows with guys especially, that's what you have to do.
Happen.
This is what we're going to do.
Yes.
Well, especially
and you're going to feel that. Like in a year, you're going to come thank me for all of this.
Yes.
And that's what's so good.
Range, yeah. Mid 40s to early 50s.
Oh, the old guy. But you're right.
It's serious.
But he's in better shape than you and I.
Yeah.
Well, but my dad died at 58, and I'm 53, and it's one of those where you start to think about these things, and you're reading about what should I be eating and not eating, and how much should I be sleeping. I got this stupid Oura ring now that tells me every time I do something what I'm doing right and what I'm doing wrong. And I was laughing when you said that. I went to see my general practitioner recently. I walk in, they take your weight, they take your height,
blood pressure.
Yeah, and they're typing on the keyboard. How many symptoms? Okay, and he's like, let me check your heart. Let me check this. All right, and you need anything else? I'm like, yeah, like I
Can we talk?
Yeah, it was miserable. It was like he's just running through to get to the next guy. And I like him; he's a good dude. But it was like I didn't feel like I want to go for my annual checkup.
Yeah,
and I felt like he was just trying to get through to get to the next guy.
Well, so
again,
again,
and cough.
No.
And it's like you said, like I think deep down, he doesn't want to do that, but he knows there's 8 people waiting that are getting more frustrated, and there's more coming in, and it's just
it took me 45 minutes late because he was running through
and
everything.
It's like you said, that's why you don't want to take on too many members, because then you're going to turn into that.
So I will. I'll tell you. So I told you beforehand that we did start a Solid Health podcast here with Podcast Video, and my wife actually interviewed me recently, and I kind of went into a deep dive of the system and the structure of how physicians are compensated, how there's several different incentives and how those incentives are aligned. I won't bore you with all of that, but it really is a complicated system. And so in order for that physician to be successful, they've got to see 25, 35 patients per day to really be financially viable.
How many?
25 to 35 for sure.
Yeah, times 10 minutes each.
Yeah. And so the problem is, again, the docs they'd like to spend more time.
Yeah.
And the problem is they then have the documentation of those 25 to 35 charts. And so they're burnt out. I mean, it's one of those fields. We were talking about physician burnout 15 years ago. You talk about it today, it is next level. So during COVID, there was a mass, early retirement of physicians, and we're really in a position where, the future could be a major shortage. They're predicting that. So I applaud, places like, here locally, the Alice Walton School is getting ready to open up.
Yeah.
Which is right like what you're doing. It's very preventative.
Yeah,
right?
so we're excited about some of some of those opportunities. We hope that there's going to be ability for students to come check us out. We are a blend of functional medicine and primary care. Functional medicine is about getting to the root cause of a disease. It is a more natural approach. Again, throwing in diet, lifestyle into those things beyond just the immediate fix. And so, yes, it is in that concept and in that same wave.
Yep.
And so for us, we love that there's more people interested. And I will admit there is a lot of momentum right now nationally, which is awesome, to recognize that, everything that's in our food, our water sources, different things like that, it's okay to ask questions. It's okay to look into them, see if there's things that we could do better, because the fact of the matter is that Gatorade that we drank from the glass bottles is not the same Gatorade that my kids are being served today.
In the plastic ones.
It's not. And it's more than just the material that it's in. You look at the ingredients list. And so I'm not trying to harp on that too much either, but it is one of those things where you have to be more aware.
Yep.
And it's funny you're talking about the age. Our target market, it has actually become pretty honed in that 35 to 50 range, and it is.
You're out.
You missed it.
I'm out.
You're
Have my membership over to Bobby.
We'll just send you out to pasture. See you, dude. Been nice to know you.
When I do my membership to you, Bobby.
Hey, but as they said, you're more fit and you feeling young, so don't let them get you on that.
Thank you. Age is just a number.
But I do look. You mentioned, and it's funny. It comes up in my conversations literally daily. The biggest contributors as to why people are looking in that 35 to 50 range. Number one, the parents. So the parents either passed away young and it made them think, or they're not aging as well as that you personally want to age. So if I'm sitting here, I'm 42, I'm saying, okay, my dad's 72. He's actually doing terrific. He just had a hip replacement and he's kind of rocking it. But I definitely look at, I want to be as active as he is at 72.
Yep.
That's like phase one. Phase two is my children. I grew up eating pizza and Lucky Charms for breakfast because
Bobby had
that's
today
just
for
kind of
breakfast
what.
and lunch.
No,
Maybe so.
my lifestyle changed.
We'll get into that.
Today was probably the worst meal I've had. Bunch of subs, samples.
Because you've lost like 40 pounds, no? 50?
Someone.
They're good.
See, you're on the path. That's a good.
He on a path.
He doesn't even need to come see you now. He doesn't need to see you. That's what.
to come see you.
Yeah.
Yeah.
Yeah, but so what? As a parent, I've got two girls, 9 and almost 11. I want them to be much healthier than I am.
Yep.
And so then I'm saying, okay, well, I need to get myself in check. So it's like, okay, I'm seeing what is going on with my parents. I'm seeing I want my kids to live healthier than I do. Well, I also need to prioritize my own health. Yep. And so that sweet spot is kind of where it hits 3 generations, and you've got a lot to live for and a lot to take care of and a lot of responsibility. And so you mentioned business owners, you mentioned high executives. Stress is an absolute killer. You got to take care of yourself, and even small changes in your life could make a big impact.
Yeah.
Or some preventative screenings. We do one of our. So we mentioned the wait list. Obviously, we opened something in April of last year that's new that we're really excited about. That are like short-term packages. To where they can be more targeted approaches, maybe somebody who doesn't need full membership or somebody who's on the wait list and wants to tackle something first. One of those is our heart health package, and what it does is looks at an advanced lipid, advanced cardio panel with labs, but it also does EKG, a fight or flight measurement, a variable heart rate, as well as a carotid artery scan.
Have you had your heart checked?
No, but sign me up.
You need that. So, I would say just as at our age, everybody, all 4 of us, it's something that you should absolutely do.
My wife's on me to get the other thing checked too.
Which one?
The
what?
The back door.
His giggy.
Jordan, you guys do that there?
No comment.
Jordan's got big fingers too.
Yeah.
They don't let me on the medical side.
Probably like, were both of his hands supposed to be on my shoulders?
As he's coughing.
As he's getting ready.
Stop the cough from the plate.
He's done it and he's not telling us, I think.
Jordan, can we do a free rectal exam for Bobby on the podcast?
We can.
Okay.
Would you like male or female?
Female. If I have to do it.
I do want to come back to because when the Alice Walton thing started coming, I didn't understand. I'm not in that industry. And then somebody said to me, why should you go to the doctor when you're sick? Why wouldn't you go to prevent yourself from getting sick? And I go, that makes a lot of sense. But like nobody has ever thought that way. Like you probably went to the doctor or thought about going to the doctor when you had 102 fever for 7 to 10 days.
Yep.
But we don't go to the doctor in advance to ensure that you're physically fit and not having to go through all these issues, which it makes a lot of sense to be thinking that way. And historically people have not.
Yeah, it's a mentality shift.
Proactive instead of reactive.
Yeah, it's like we're always behind the eight ball the way that we've been doing it.
Let's be honest though. I mean, it's about time, right?
Yes.
I mean, so if something's not like burning in your life, that's a problem that's causing you to slow down. You don't slow down and do it.
He does have that burning though as well.
It's from the bourbon we're drinking.
But no, it is a different mindset. And again, I look at it as if you look even from a cost standpoint, because you can connect with people a lot of times when you start talking about money. It's hard again to invest today if you don't immediately know there's a problem. But when you have that like stint that needs to be put in,
not to have.
you're going to pay out the nose. And if you could have delayed that by 15 years,
triple that.
And not to money, you'd have money to be able to invest in other projects, different things like that. So it really is a prioritization of health. And I tell people all the time, over 90% of, and you guys, it's, the multi-trillion-dollar GDP that is spent on healthcare, 90% of it is spent on chronic disease. It's when you're already to a point where you require that. And so if more time, money, energy was invested on the front end, then the amount spent overall by yourself and for your community and for the country would be significant.
It's a no-brainer, but we just haven't got people thinking that way just yet. That's why you're here.
That's why we're here. Yeah. So and it's honestly, like you didn't ask this, but I'll tell you, it's why we chose Northwest Arkansas. So I'm from Northeast Oklahoma. We were in Oklahoma City when we started Salt Health. I was working for a health system there. And Northwest Arkansas, obviously growth, economic engine for the state. All of those things are important. But there was a recognition of my wife and I, Dr. Herbst, that this was a community that cared and was excited about health and wellness. And so you're seeing that now again with the Walton School for the medical school, but also there was a recent announcement with the Cleveland Clinic and a cardiovascular partnership. But even beyond that, the trail systems, the food and restaurants here. I mean, you can go to and gluten-free is not end-all be-all. Don't leave here thinking, well, if I eat gluten-free, that's healthy. Sometimes they just throw in more sugar, for gluten-free. But having restaurants like some of the ones downtown in Bentonville that have dedicated gluten-free menus, or who choose to use more natural local ingredients instead of the soybean oils that
just homemade.
Right.
Yeah.
Right. And so all of that was something we researched intently for Northwest Arkansas, and they were like bam, bam, bam. We just kept seeing thing after thing where we're like, this is a community that will get the concept of prioritizing health. And so the great news was within 3 years of us opening our membership, we had to actually close or pause membership.
Thank God you and I got in before they closed it down.
And here we go.
We're excited about that.
Yeah.
Want to go tomorrow for lunch? After lunch?
Yeah.
Here he said he's actually going to give me a free
I like that hot and cold sauna where you
amazing.
Can, get back and forth.
It's
good for it. Just flushes all the toxins.
All the toxins.
All these toxins, right?
Yeah. Exactly.
Don't worry, the conversation doesn't end there. Stay tuned for part 2 coming next week.